Good morning, everyone. Welcome to Sunrise Daily. I'm Chamberlain Uso.
It's a beautiful Tuesday morning. I am Kaido Kikelu.
I'm Ayo Makine. Good morning and welcome.
Good morning from Abuja in the Federal Capital Territory. I'm Maopo Yusuf.
Indeed. So, after all said and done, now we know that the first phase of the ease of lockdown has been extended. The PTF did make that announcement yesterday, and you know, I know there'll be a lot of conversation about, okay, but we were moving anyway. Things were going on, but yes, we'll be getting some explanations concerning all of this, why it has happened, what to expect moving forward, and several other matters as that. But these are part of the reasons why that was done. Look at the cases coming through now from the NCDC. Lagos again topping that figure, but they just thought, look, looking at how things have panned out previously, these numbers are the reason why they had to go the way they had to go. 6,175 and 106,644 of those discharged. So Lagos recording 74 cases, but you know, sometimes you look at Katsina, you look at Kano, the figures as they alternate. Well, Katsina this time has got 33, not taking your eye off the ball in terms of the security challenges that some local governments in Katsina State are currently experiencing. And then you find this one. So it's a bit tricky for them trying to coordinate as well as ensure that people are mindful of this particular one. So even though they've told us, look, this will be with us for a while. So how we adjust to this moving forward, it's going to be very instructive. Yes, you can eventually also take a look at the regional case-by-case basis. And this is where that interstate lockdown, perhaps, will it make sense? Will some of this happen and the figures keep going up? You just wonder. Yes, indeed. As you heard, the search is frenetic, and we're not left out in that. So we do have a representative of one of the agencies saddled with the responsibility to ensure that we get a solution to this. Is Dr. Obi Adigwe, who is the DG and CEO of the National Institute for Pharmaceutical Research and Development. He joins us from Abuja. Good morning, and thank you for joining us again today. Well, quite a number of things have happened ever since, but some of those reports we saw, we might as well just get them out of the way. But first, look, tell us, where are we now looking for solutions at the moment? Could you tell us, at what point would you say we are?
So solutions are broadly divided into two categories. The non-pharmaceutical measures which are being put in place. Obviously, you heard about the updates from the Presidential Task Force yesterday, speaking about the extension of the slightly released lockdown in certain states, and for the need for there to be specific targeted lockdowns on other areas where there are hotspots. So that is progressing in terms of ensuring that non-pharmaceutical measures are being put in place to control the spread. Obviously, that's the gold standard now, because as at today, there isn't any cure for COVID-19. What most researchers and clinicians are doing is symptomatic treatment. Now, for the other part, which is looking for a pharmaceutical, phytomedicinal intervention, there is also some progress on that side. You heard about the emergency registration that was done by the FDA on remdesivir. I'm sure you obviously know that Nigeria has also signed up to WHO's solidarity trials. And then in country, there are a number of us who are also putting together protocols for undertaking clinical trials with our own particular combinations and with interventions that we feel are more contextual for the Nigerian population. Additionally, there are a number of phytomedicinal products or medicines of phytomedicinal origin which are being put forward, and I think some of them have now been submitted for us to validate those claims. So all this is the entire spectrum of what's going on in terms of addressing the COVID-19 pandemic in Nigeria.
All right, so some of the reports we played there, they also talk about the COVID organics from Madagascar. The government has said we'll subject it to all the required processes before recommending it to anyone in the country. So is your agency part of those who will be examining that product?
So when a product comes into Nigeria, there is a process for which that product will be subjected to before it is considered deemed fit for consumption in Nigeria. The rate limiting step is having that product registered by NAFDAC. Unless a pharmaceutical product has been registered by NAFDAC, categorically, that pharmaceutical product is not fit for consumption in Nigeria. And so if a product comes in with all the data that is required for NAFDAC to undertake that assessment, then NAFDAC uses the data that the product came in with from outside Nigeria in order to make a judgment call as to whether to approve that product for use in Nigeria. However, if the product comes in without a complete set of information within the database that's meant to accompany that product, that's where institutes like NIPRID step in. National Institute for Pharmaceutical Research and Development, our job is to use empirical scientific methodologies to collect data. Once we get the data together, then the owner of that particular product, the person who has the marketing or who is applying for the marketing authorization, now presents that data to NAFDAC. Now, coming specifically to COVID organics, there's been quite a flurry of interest as regards COVID organics. And I think the discussion is not looking deep into what we should be looking into. The discussion about COVID organics, the bringing in of the product and the distribution across to other African countries has generated a lot of interest, but the interest is in the wrong area. I think we need to look deeper, and I'll tell you why. Madagascar, who came up with COVID organics, is one of the world's biggest producers of Artemisia annua. Some of our preliminary data shows that Madagascar produces up to somewhere around 10% of the entire Artemisia annua, which is used across the world. And when the COVID pandemic came up, COVID-19 pandemic came up, what they did was Dr. Charles Andrejana, who is the head of the Institute Malgache de Recherche Appliquée, reports directly to President Rajoelina. And what these people did was to identify something that grows within Madagascar, undertake some research on that particular product, and then present it to the rest of the world as something that can potentially contribute to addressing COVID-19. Now, you can see that that country has wittingly used a resource for which they are one of the world's biggest producers for, and used it to develop an intervention that's focused on a disease that's relevant not just for Madagascans, but for Africa. And then very cleverly, President Rajoelina has become the champion marketer for that product. So post-COVID-19 and during the epidemic itself, what it means is that potentially a number of countries will be depending on Madagascar for that product. So in one fell swoop, they are contributing to addressing healthcare concerns within their people's population, as well as stimulating socio-economic development for their people. Because as they're exporting COVID organics, there are farmers who are producing more of the Artemisia annua. There are people in the processing industry. There are people in the packaging industry. There are people in the distribution industry. All this within Madagascar. Everybody is being employed and they're generating a significant amount of socio-economic activity. That's what we're missing.
Right.
And
just
that's
a
where
moment.
I think we need to focus our discussion on.
Right, but then I'd like to also take you up on something you said earlier about validating or registering, drugs, as it were. Now, you say if the data comes in and it's complete, then it will be registered. But if it's incomplete, then you will have to step in to do some work. But even at that, even if the data is registered, shouldn't we at least still probe into it and try to break it down and see what the drug really entails, rather than, depending on the data that comes in?
Yes, we should. And there are two ways we can do that. So when this product comes in, depending on the data it has come up with, NAFDAC has its own laboratories and NIPRID has its own laboratories. So the laboratories in NAFDAC are capacitated to look at that particular product to say what and what have what has this particular profile indicated are the active constituents? What and what are the excipients involved in this? And they can run that analysis to identify whether it fits into what the profile says it has. If it comes to NIPRID, NIPRID also has the capacity not just to look at the constituents of that particular product, but also to start to underpin the formulation with some form of research capabilities. So if it's something that comes in and we look at it and it contains Artemisia annua, NAFDAC will say, yes, this contains Artemisia annua. But NIPRID will say, yes, it contains Artemisia annua. But can we also compare it to the Artemisia annua that grows in Nigeria? Which one is of higher quality? And this is something similar that we're doing for neem. As a director indica is neem, Dogon Yaro, popularly known as Dogon Yaro. And we have a project on that particular product. And part of what we're looking at is comparing the quality of neem that grows in Nigeria to quality of neem that's imported, for example. And so, assuming COVID organics came to NIPRID for analysis, that is the extra bit that NIPRID will be doing. But so far, we haven't received any sample of COVID organics to undertake that analysis. So this is basically a theoretical statement now.
Pardon me, just to get it clear, COVID organics has not come to NIPRID. NIPRID is not involved at this point, right?
Not at this time. Not at this time. We haven't received any sample of COVID organics, and we haven't received any indication that we need to undertake some work. However, you know how government works. There are certain bureaucratic processes that need to be undertaken. And the fact that as at this morning we haven't received it does not mean that we may not receive it in the next day or so.
About bureaucracy, I also understand, we're made to understand that the PTF COVID-19 has appealed to your institute as well as NAFDAC to maybe, perhaps the word they used was relax some of those protocols so that we can have some results quicker, stemming from what my colleague asked you, how far we have gone in seeking a homegrown solution. So is it true that you've been asked to relax some of these protocols? And how far have we gone in examining whatever it is that are on your table at this time?
Well, I don't know first of all, the presidential task force will give us a directive. They're a presidential body. The presidential task force would not appeal to NIPRID. They would direct us to look at our procedures. And without even waiting for that directive, what we've done at NIPRID is that we have expedited our processes. So in science, relaxation is not a term we're familiar with, because a scientific process needs to, if a scientific process needs to go through A, B, C, D, it has to go through A, B, C, D. What we are doing at NIPRID is, rather than skipping B and C and jumping from A to D, what we're doing is that we're working day and night to still make sure that we go through A, B, C, D. But if we were to deliver A, B, C, D in 4 days, we'll be delivering it in 2 days. And we worked over Christmas at the National Institute. We also worked over Easter to deliver on some of the things we've done. And a concrete example I can give you was when we presented our concept product development on the sanitizer. We were given 1 week to present a product to the minister. I think we achieved that in 48 hours using this particular model. So that's what we've done. We've expedited processes. Our people are working on a daily basis, working day and night. And additionally, like I mentioned the last time I was here, we've put together a national advisory committee of eminent and erudite professors across the country to also, chip in their own expertise and cognate experience for areas where we would need things to be sped up. So that's what we're doing rather than relaxing any protocols.
Shortly after you were appointed some years ago, and you granted an interview concerning vaccine production, you did say that despite the great potential of the Nigerian pharmaceutical sector, relevant policies and partnerships have not either been articulated or implemented to stimulate local vaccine production. Now, ever since you said that, have things changed?
Well, Chamberlain, thank you very much for picking up on that. I started to make that argument even before I was appointed 18 months ago. When I was the executive secretary of the Pharmaceutical Manufacturers Group, the then chairman, Dr. Okeakpa, and myself articulated and pushed the concept of medicine security as something that we need to be looking at as a country and looking at very, very seriously. I gave you the Madagascar example. In Nigeria, we have so much more potential, and our medicine security argument proposes that unless you're able to determine how your medicines are produced and distributed, you cannot determine that your people will have a sustainable access to high quality, affordable medicines, whilst at the same time ensuring that your people are benefiting from the socio-economic benefits that accrue to producing these products. After I was appointed, we developed a contextual processing protocol, and this protocol identified 3 phytomedicinal products across the country, 3 in each state across the country. And the investment of state governors in this particular phytomedicinal products will add value to the healthcare situation of the people in that state, as well as for all Nigerians, whilst at the same time stimulating job creation, capacity building, income generation for the individuals involved in the project, as well as for the subnational government in that particular setting. And this is exactly what the Madagascans have done with Artemisia annua. In Nigeria, we have over 36 products waiting, and so far, only the governors of Kaduna State, Anambra State, Ondo State, Katsina, Edo have engaged with us. The remaining 30 state governors, we've barely heard from them. This is just to show you the difference in the medicine security engagement between the Nigerian side and the Madagascar side. But coming back to your particular statement about vaccines in Nigeria, whilst I was at the Pharmaceutical Manufacturers Group, we argued strongly that based on medicine security principles, Nigeria, with a population of 200 million, should not be abdicating its responsibility for production of vaccines. And barely after a month that we gave a press statement on this, we had the meningitis outbreak, where Nigeria literally went across the world and, barely didn't find anybody who could supply meningitis vaccine, because meningitis is endemic here. It's not endemic in Europe. It's not endemic in the Americas. And this particular administration took on board our medicine security proposal and signed a 6 billion naira partnership between government and a private local manufacturer in Nigeria. That was a big step in the right direction. However, we must understand that vaccines manufacturing is not something that can be done in 6 months or even a couple of years. It's a long process, and I'm happy that this administration has prioritized vaccines manufacturing. But in terms of COVID-19, I'm afraid those capabilities will not be brought to bear to produce a vaccine in Nigeria for this particular pandemic.
Yeah, I noticed that you also spoke about a certain 6 billion naira agreement that the federal government signed with a local manufacturing company for the production of vaccines. Where are we with that?
So I can only tell you, my role for that particular partnership was the advocacy we carried out from PMG-MAN prior to my appointment as Director General of NIPRID. Having been appointed Director General of NIPRID 18 months ago, I have stepped back from that particular advocacy. My role now as Director General is to develop a research and development strategy and framework for vaccines manufacturing in Nigeria. So I cannot claim to be intimate with the details of that particular partnership now. But what I can tell you, based on updates that I've received as a member of the top management committee in the Ministry of Health, is that a bio-vaccines company has emerged from that particular partnership. That company, I think, is chaired by Professor Oyewole Tomori. And I think, I can't say this categorically, that they've made several steps in the right direction, but I would doubt that they're in any position to start manufacturing vaccines in Nigeria within the next 18 months.
While we are at that, very, very quickly, if you can give us this one, there is this committee set up by NAFDAC, Herbal Medicine Product Committee. Are you part of that committee, and how quickly do you think Nigerians can look forward to something from NIPRID? Sanitizer.
So, how fast can Nigerians get something from NIPRID? As quickly as we get funding. NIPRID has developed a product called NIPRID, which has strong immunomodulatory activity. Most of the, if not all, of the preclinical tests have been done. Findings from the preclinical tests have been published in international peer-reviewed journals, and there is incontrovertible evidence that that particular product boosts the immune system. As you're aware, the people who are at the highest risk of succumbing to COVID-19 are people who have underlying illnesses or people who have compromised immune functions. And so this particular product, NIPRID, can be seen as an invaluable tool that will contribute to any clinician's array of medicines that they can give to COVID-19 patients. However, best practice internationally is that these type of products need to be subjected through clinical studies. Clinical studies are not cheap. I think it was about 3 or 4 years ago, my predecessor at the National Institute of Pharmaceutical Research and Development presented this particular product, as well as other products that we had for hypertension and other products. And there was some indication that government would provide additional funding.
Okay.
And,
so we're definitely going to keep tabs
now,
with your agency to see how things develop, such that whatever information that you do have, a progress report can always be relayed to Nigerians. But again, we do thank you for coming on this morning, Dr. Obi Adigwe.
You're welcome, Chamberlain.
All right, and we're back in a moment. Stay with us. Welcome back. Yes, indeed, as you may have seen there, the Minister of State for Health joins us next, Senator Lauren Imbemamora, to shed some light on the decision of the PTF on COVID-19. Good morning, sir. Thank you for coming on this morning. So, well, mixed feelings in the country.
Good morning.
All right, mixed feelings in terms of how people are receiving this announcement. I'm not sure the task force is surprised at how people will respond to this. But before now, there had been a comment or two, I think including yourself, not being satisfied with the way that Nigerians were complying with the first phase of the ease of lockdown. So I'm just wondering now, having taken this decision to extend this first phase, was there an overarching thought or mindset among the committee that, well, this time around, Nigerians, we will all get it right?
Well, one thing that we all must hang on to is hope. And when you lose hope, then you lose everything. But when you keep hope alive, then there is much to be achieved. Yes, as you rightly did say, we've not been too comfortable with the level of compliance of directives and directories issued by government in respect of managing COVID-19 with respect to what we call non-pharmaceutical interventions. So we hope that Nigerians will really see the need to come to terms, with the reality on ground in terms of taking responsibility for their own health, because the primary responsibility for your health lies with you. So in the circumstance, what we needed to do was to extend the period of the first phase.
Okay, I know that you also spoke about the strategy, the 3 T's that you like to implement moving forward, but could you tell us about the how? I know my colleagues have talked about communication such that people can understand these messages and then operationalize and execute them. But how do you, or how is this policy or this next phase, those specifics, what should we expect?
Well, essentially, there will be needs. We will continue to ramp up our sensitization and awareness campaign, which we've been doing all along. And some people, well, will appreciate that. Some still kind of live in denial. And that's a major issue. which we will continue to do this advocacy, reaching out and having engagement with various segments of the society, the faith-based organizations, the civil society groups, the community leaders, name it. We're going to reach out. And of course, the high-level engagement with the governors of the various states themselves, because as elected officials at that level, that very high level, they have to do a lot in their respective states. And you also appreciate that they are the ones that will really do the enforcement in their various states. So there's also the issue of enforcement. They need to appeal to law enforcement agents to ramp up this enforcement as well. Of course, we will also need to do more testing. We need to do more testing, having opened more laboratories. We now have, I think, about 27 laboratories. So this will help us increase the pace of testing. In so doing, of course, testing is not just about sample collection. We have observed the delay of sort in terms of turnaround time. So we will need to look at the logistics involved and do what we need to do to reduce the turnaround time of having test results after samples have been collected. Well, we still do some tracing, contact tracing where we can. Unfortunately, in most of the states, we have virtually moved into the community phase of transmission. And when you are at that level, it becomes quite difficult for you to do any meaningful contact tracing. Of course, the third T there, I talked about testing, I talked about tracing, is treatment. We have our treatment centers all over the place, which hitherto was at about 3,000 nationwide, but that has increased now to about 5,000. So we need to do the treatment. So that's another thing that we need to do. And of course, we also need to continue to monitor activities of our people in terms of managed approach. When I say managed approach, because the markets have been opened, but there are things that we expect to be in place to make that effective at various centers of activities in terms of economic activities, with the things that we need to monitor. Of course, the use of face masks is very important. The need to enforce physical distancing is very important. In our transportation systems, people getting into buses, going to work, getting into kidnap and all that. Because all these things have been spelled out, but it's not enough for these things to be spelled out. It's very important that people comply with the directives and advisories in this regard.
Well, if we can try to unbundle some of the things that you have mentioned, Doctor, it would seem like all the things that you have talked about are the things that we did over the past 2 weeks. And this is the result that we have. We have to as my colleague said earlier, repeat this same class for another 2 weeks. Now, to the issue of the governors, the interface with governors that you mentioned, I understand that the PTF COVID-19 has had to interface with the governors in the previous 2 weeks, had this kind of conversations that you talked about as well. Going forward in the next 2 weeks, what is going to be different? Definitely, it is their job to execute some of the things that you have talked about, and ultimately, it is in these states that these cases are going to be treated. What is going to be different in the interface of the committee, the PTF COVID-19, with the governors in the next 2 weeks?
Well, you know that the popular saying that repetition enhances emphasis. So we will continue the engagement. You recall that even as we speak, we still have issues with some state governments in terms of, cooperation and collaboration. One or two states we're still having, much as we appreciate that need for engagement, for collaboration and all that, I wouldn't say that the cooperation has been absolute. So where one or two states where we seem to have issues, we continue to appeal to the state government in these states, affected states, and getting them to see the realities, maybe from our own prison, because they may not see these things from their own end. So we continue to talk to them, and I did say earlier on that the issue of hope, you just have to sustain hope and believe that along the line we will all be seen to be working, not at cross purposes, but having the same understanding regarding the issues we are trying to manage. So we will continue. It's just to increase the engagement. And you recall that even yesterday, Mr. President had a virtual engagement with the state governors. And that is part of the efforts from our own end, that Mr. President, being at the highest level of government in the country, now having this engagement, is part of that, is part of what we intend to achieve. And now, Mr. President himself engaging the state governors, I think that will also go a long way. So we are not relenting. We're not relenting in any way.
I don't know if that is to suggest that the governors and the PTF COVID-19 are not on the same page, so to speak, about how we should be approaching this matter. You may want to react to that very, very quickly. You mentioned some states that you are not getting adequate cooperation from. Any particular states in particular?
Well, I think let's just leave that. The important thing is that we are having greater understanding in terms of our approach and engagement. You see, we talk of what WHO has suggested from day one is to have one national response. And when we say national response, yes, we do know that we operate subnational governments as well. So one national approach, but when it comes to implementation of policies, because of the differences in terms of areas and the realities, this may not be absolutely same. So we will allow for local peculiarities to be taken on board by the respective governments at the subnational levels. But be that as it may, we will still, because at the end of the day, in terms of assessment, it will be on the national output. So we are getting that, we are pushing that through, and we are getting some level of a high level of cooperation. Well, there may not be perfection, as I mean, any human situation, but then where we have the challenges, we are doing all we can to ensure that the rough edges, so to speak, are smoothened.
I mean, if you could just shed a little more light so that I can be a little clear on that. When you say one national approach, does that mean that when policies are pronounced, at that level, the states, perhaps if they want to ease their lockdown, can then seek that permission to ease the lockdown? Is that what you mean by peculiarities from different states, or what exactly do you mean?
You will recall, Chamberlain, for example, even the issue of night curfew, it was already being implemented by some states, which was based on certain realities in such states. That's one. If you look at the issue of easing of lockdown, in some states, the easing of lockdown had been put in place even before the national pronouncement. So these are some of the things. Of course, the prohibition on interstate travel and the like. So these are some of the things that some of the states had even put in place prior to making a national pronouncement and all that. So what we are saying is that they know, he who feels it knows it. They know certain realities in their state, and we are not objecting to that. But when we talk about policy, if we say, well, we need to reduce interaction, we need to reduce contact. So there are various ways that this can be implemented. So this is what I mean. And
okay.
Of course, some of the states, they have not really waited for the national body, as represented by NCDC, to open the PCR testing centers. They have gone ahead. They will still invite the NCDC to come and verify, and then, of course, give them accreditation in terms of the what ought to be on ground for testing purposes, PCR-based testing. So this is what I mean, that it's still one national approach, but you will still take on board local peculiarities in terms of implementation of that national policy.
Okay, now one of the challenge points was that, some state governors had spoken up about the interstate lockdown, how security agencies were compromising all of that process. So what's going to happen? Has there been any conversation with either security agencies in terms of how to progress or how to do things moving forward?
Oh, yes. It's part of the engagement that I also mentioned, because I must commend our security agents, because at PTF level, we cannot do it alone. We have to continue to encourage where there are lapses or gaps that are identified. We'll try to correct, we try to bridge the gaps. So the security officials, I must commend them, because they are also part and parcel of our first line workforce, so to speak, because you see these people on the roads, doing their checks, and they're looking at, ensuring that people comply. So they are also being exposed one way or the other, because they do not know what these people, the passengers, possibly, or the people that they come across in course of their legitimate duties, to the nation. So, yes, we do talk to them, we engage them, and where we get a feedback that we need to follow through, we do that. Maybe, you know, 1 or 2 misdemeanors and all that. So these are part of the things that we do. And when we talk of all of government, all of society, these are some of the things we mean. That everybody has a role to play, and we need to bring everybody on board to achieve the desired goal at the end of the day.
You know, so some will wonder, when you say misdemeanor, do you mean maybe collection of bribe? And would also like to know, has there been any commitment from those security agencies, maybe at the level of the leadership? Has there been any form of, you know, acknowledgement of these things, and then they say, moving forward, we're going to ensure that these things stop?
Oh, yes, yes. We like I did say, we have established some not too good situations. We bring things up at the various levels, you know, whether at the level of the police, at the level of the armed forces, you know, the various, you know, levels, you know, whether it is military and whether it is even the officials of internal affairs, that is immigration, what have you. We engage all these people, and they have representatives at the PTF. So we have a kind of daily briefing as well in terms of activities, in terms of what has been observed in one location or the other, whether at the land borders or, you know, just name it, whether at the border, at the seaport and what have you. We have daily report, and we have this interaction, and of course we examine what is before us, and we decide what to do in the circumstance, and whatever level of engagement we need to put in place, we do that, and I mean on daily basis.
Okay. Now, this is meant to, this extension of the phase is meant to end by 1st of June, in about 2 weeks. And the big question for a lot of people is, what is the goal we're trying to achieve? Are we trying to say that at the end of that period, we should have gotten to a level where we record maybe 50 cases and below, especially because people want to know what the goal is so they can key in and say, this is where we're working towards. So what is the goal? What are we hoping to achieve with this extension?
Well, essentially, whatever gains that we might have made so far, we're hoping to consolidate on such gains, whether in terms of sensitization and awareness creation. We want to consolidate on that, whether you're talking, number 2, in terms of the readiness, you know, response activities, whether in terms of our treatment centers or our isolation centers or the human resource for health capacity, whether in terms of the ambulance services, just name it. All this, whatever gains that we have made so far, we need to consolidate on them and improve on what is on ground. We're opening more treatment centers. You recall that just some days back, about last week, the This Day Dome in Abuja, which is a very large center for treatment and for isolation, you know, was opened, of course, and we are putting structures in place to now make the place run. You know, we had official handing over. So these are some of the things that we want to achieve, and of course, we go ahead to monitor compliance in terms of the basic things that we've talked about: wearing of mask, hand washing, and of course physical distancing and all these things. So we're just going to improve in terms of getting people to comply with these directives. Those are the things, and we feel that given another 2-week period, we would achieve more. Even in terms of our testing, like I said before, having opened more laboratories, we need to see, how much we're achieving, in that. I mentioned the issue of turnaround with time, which is a little bit not what we want it to be. So we will look at what we can do to increase that, because that will go a long way to help. Because
okay,
if you
just
have
a couple
people that are waiting for the results.
Okay, just a couple of more issues that we'd like to clarify from the people as well. They'd like you to speak to those issues, but we will do that when we come back in just a moment. Please stay with us. Welcome back. Well, we still got the Minister of State for Health, Senator Olorunimi Mamara, with us from our studios in Abuja. Well, Senator, some of the challenges that we're looking to solve while this additional, this 2-week first phase is being repeated is that there are those who are of the opinion that, for instance, in states where they have lockdown till 3 p.m., they just wonder, they think that that targets the regular 9-to-5 workers, that some of the other people who have got to be on the roads beyond that time, people who make ends meet, who it turns out that those are their own peak period where they make money. So it's difficult to coordinate all of those things. So in terms of getting results and doing things differently, does the PTF on COVID-19 factor some of these challenges? Is there more stimulus package going on to people? What's happening in that regard?
Thank you very much, Kimberly. Yes, that's part of what I said earlier on, that states, yes, you agree on a lockdown, fine. But in terms of implementation of this lockdown, you discover that this may vary from state to state, looking at certain realities on ground. Now, once you put in place lockdown, you cannot achieve all the desired goals without backing it up with palliatives. No doubt about that. That is the truth. And that is what is being done through the Ministry of Humanitarian Affairs. So we necessarily must put in place palliative to help cushion the effect of this lockdown, because there are people who are daily paid. I mean, in terms of eking out a livelihood. So we must take on board this. But in so doing as well, we are also conscious of the fact that it might be difficult to really reach out to everyone. That is the truth. So, but in as much as we can do as a government, we will do. And that's why I want to appreciate various groups that have been helping out as well. Various NGOs, various faith-based organizations, various individuals, groups, companies, name it, that have been coming out to help. You see this in various places where food items are being supplied to people in one form or the other. This is the kind of partnership which we very much appreciate. So I'm just saying that what your observation, it's right. That is, palliatives must back up this lockdown if we want to have appreciable results. So that is being done.
Palliatives, especially for daily earners. You also mentioned that the transporters are part of these daily earners. But then I just want to find out, Are there plans to interface with the transport unions all over the country, whether at the state level or at the national level? Because just as you mentioned, interstate lockdown, there's been flagrant disregard of that one. And even, at daytime, many of the guidelines that PTF COVID-19 and the state governments have come up with, many of them are largely disregarded. Is there any plan to interface with transporters, the various transport unions, commuter buses, and even, haulage vehicles on this in the next 2 weeks to see how much gains we can get within the next 2 weeks?
Yes, you recall that I did say earlier on that the engagement is continuous and it's continuing. And it's at all levels. We try to identify the gaps. We try to identify where things have not really been smooth. And we look at what we can do in this circumstance. Yes, we are engaging them both at the national and at the state level. So, with a view to finding out, amicable resolution of the gaps that we have seen, and seeing how best to make people, reasonably comfortable. There's no doubt that this is a very, very difficult moment for every one of us. And I mean every one of us. It's a very difficult moment. But again, we need to continue to appeal to people to appreciate that whatever discomfort or whatever difficulties that we are going through at this point in time, it's only for a while. And that is where we need this cooperation for the good of us all. Oftentimes, when we talk of enforcement, if we all appreciate the realities on ground, then you won't even need to do this enforcement as such, because it's just a matter of, saying that, look, for you, for me, that kind of approach. That is, whatever you do that will, save my own life, whatever I do that will save your own life, should be the approach. And if we have that understanding, then the enforcement that we need to put in place will be minimal. It will just be out of appreciating that this is a duty I owe to my fellow, men.
So as we wind down, we have just about 20 seconds to wrap up this conversation. I'm just curious, is it possible to have a list of goals that we hope to achieve at the end of this period? Maybe how many daily cases we want to achieve, how many tests we want to achieve, and some of those, visible deliverables so people can see it and say, okay, this is the destination, let's buy into it. Is it possible for the PTF COVID-19 to come up with such? Well,
yes, it is. Even if it's not necessarily quantitative, but it can be qualitative. The one that we can't quantify. For example, you recall that before the lockdown was even put in place, we had just 15 laboratories. But as at now, we have 27. And I do know that before we end this 2-week additional period to the phase 1, we will have increased that. We are at 27 now. Probably by the end of the 2-week period, we will have had or established test laboratories in every state of the country, which will go a long way to increase our testing ability. Again, the turnaround time that I mentioned earlier on, which for now is between 48 hours to even 72 hours or more. We want to be able to reduce that to about 24 hours. So by the time we're able to get right certain logistics and, of course, the capacity that ought to be in place, we should be able to achieve that as well. Then of course, they take the issue of even the evacuees that come in. Thank God, you recall that yesterday some of the organizations came up wanting to assist us in that, because that's another kettle of fish on its own. The challenges we have when we bring these evacuees, and these are Nigerians. We have a duty to assist them in this period. So by the time we get out of this period, I think we would have been able to have a solid process in place that will address some of these issues. And of course, we continue to do our advocacy in terms of getting people to comply with the various measures in terms of distancing and what have you.
We certainly hope it turns out well at the end of the day. But we do thank you for coming on, Senator Olorinimbe Mamora, Minister of State for Health. Thank you for your time today.
Thank you very much for inviting me.
All right then.
And of course, that takes us to Zamfara State, where we will be hosting the chairman task force on control and prevention of COVID-19. He's also the Speaker, Zamfara State House of Assembly, Honorable Nasiru Magaria. Thank you so much for joining us this morning. So on the one hand, Zamfara State is contending with the issue of COVID-19. On the other hand, you're also contending with the issues around the Almajiri that have just been brought back home to Zamfara State. How are you handling both issues?
Thank you very much. A very good morning to you. As we said in Zamfara State, all necessary measures were taken since the pandemic arising. And as now we reach some certain levels, which is very good. If you come to the first state, you will notice that. I really am happy to inform you that due to commitment of the state government, 2 isolation centers were being provided, and all the 2 isolation centers were occupied for all the necessary materials, all the necessary equipment, and all staff, French staff were also deployed to the various isolation centers that I was telling you. Issue of Almajiris, we are handling it a very careful handling with the training staff, health personnel around the borders, around the local governments, including the state capital. In short, anytime, any moment, Almajiris coming to the state, the teams, health teams management were the best to be on ground with the security agencies to, first of all, to measure their temperatures, to use all necessary materials to sanitize them, then to isolate them for some days, at least 14 days, to comply the guidelines of the NCDC. After 14 days, when we experience there's nothing to them, we are now taking them to their families for continue doing their own life. Then also we have some Almajiris in the state that I need to take back to the various state. The committee was also inaugurated under the chairmanship of a committee who is also the Commissioner on State Religious Affairs by His Excellency the Executive Governor of the State, Dr. Bello Mamatola Maradu, with the giving him all what he needs, what he requires, and the committee is also now doing their best, taking Almajiris to the Bureau State with the very careful handling. And so far, so good. If you can be able to see all day and night, the state government, the committee are going rounds to see the pandemic was now getting at the end. So,
Right.
so many measures were taken in the state.
Okay, now we just spoke with the Minister of State for Health, who is a member of the PTF COVID-19. And one of the major issues we discussed was how states would internalize the extension of this, phased easing of the lockdown. And the question came up, if the PTF COVID-19 says this is the direction we're going, how will states internalize that? And I think it's fair to find out from you, how are you internalizing this extension? Are you taking all the directives hook, line, and sinker, or you're trying to tweak it for your own, local reality?
The states are the good people of the state that are always comply all what have come to them. We have heard about the extension of lockdowns, and we are taking it, we are comply with all extension by the federal government. As soon before the extension, the people of the state are comply, as I told you, by the rules and regulations governed by the NCDC, the health personnel, the securities, as well as the state government to ensure they comply. Well, since before the extension by the federal government, the state, we are complying and we are respecting all the enforcement. But
so I wonder
now,
right, just to, pardon me. So I wonder why last week you lifted the ban on congregational prayers in mosques and churches, which was originally put in place to curtail the spread of the virus in the state. I'm trying to balance that.
If you can be able to remember, last 2 weeks was recorded the highest numbers in the state for the pandemic. Since we recorded the highest numbers as positive, quickly the state government bans prayers, churches, and then market activities, market operation. But by the necessary measures taken by the state government, it's only a week that we went for prayers. The pandemic decreased to some certain levels, which make them for state government to now allow people to come and continue praying, but with the rules and regulations governed by the NCDC, using test marks, using sanitizers, as well as social distances. This is what makes the state government to now allow people to continue praying after a week of banning such activities in the state. If you can be able to see the numbers increased before, then after the number now decreased, then people are praying. Now, then people are going to market in one place to another, but with the comply of all the necessary measures, all arrangements.
Right. I think that just points to, how states are tweaking this to work for them. But the questions will always arise as to, whether there isn't a possibility of further spread, resurgence, or a second wave, as they have always said. But I'd like to take you up on this briefly, this allegation that has been going around on social media. You must have seen it, so I'm trying to give you an opportunity to respond to it now. Is there any truth in the claim that allowances paid to the members of the state COVID-19 force range from 220,000 naira per day for the chairman to 120,000 naira per day for members of the task force? Is there any truth in that allegation?
There's no things like that because, as I told you, since the rise of the pandemic, the state government are committed to take any necessary measures and any support. All the support we need from the state government was given to us. Then, not only for the members of the task force committee, even the trained health personnel, the doctors, the nurses, the lab and pharmacists, drivers, the surveillance that are responsible to go around and take samples, the doctors that are responsible to handle the case are paying allowance on a daily basis. Then to the members of the committee of the task force, which is my members, we are also paid in a weekly basis, not on daily. as weekly allowances. This is what we are doing, and this is what we are still doing, and we will continue doing that. So any allegation against the allowance of either health personnel or the members of the task force may render it invalid, not truth. This is the truth, what I do. Government has given us what we want, and we are doing all what we're supposed to do. We are trying our best. We are paying the allowance for all health workers. We are paying the allowance for the
We have to thank you very much for your time with us this morning. Honorable Nasiru Magaya, Chairman, Task Force on Control and Prevention of COVID-19 in Zamfara State, as well as Speaker of Zamfara State House of Assembly. Thank you so much for your time and perspectives. We're back in a moment to take some of your own contribution to the program this morning. Please stay with us.
Okay, welcome back. Now, Alabi Michael is the first message. Feedback we're just going to read out here. This was form of a question anyway. He says, what effort is the Institute, that's NIPRID, making to conduct research into harnessing Nigeria's wide varieties of plants and animal species which hold great potential in the discoveries of new drugs for most tropical diseases in the country, including COVID-19 for treatment?
We definitely need to take up the DG and some of his questions, because this next one is also a question from at E. Okala saying, please ask the DG if they have done work on the LD50. That's right. It says adverse effects and effects of the Madagascar cure on pregnancy and lactation. That's quite important. So these are some of the questions we definitely hope NIPRID will respond to.
And hope those the statistics or data sent in have some of this information. Well, this next one from Musa Mohammed references that thing we talk about, the conversation with the people, communication. Says the truth is Nigerians have lost hope and credibility in the numbers NCDC gives out daily. And many Nigerians think they are alone in the fight against COVID-19. So it's hard to see the numbers decrease. We just need a change in approach. You know, just as we said earlier, over and over again, it's always about the communication with the people to gain their trust.
But what do you mean by lost hope and credibility?
Well, there's more though.
Yeah.
Markwe?
No, that's from me. Yes, there's more from me. This one says, I listened to the interview and weep for Nigeria. Only 6 governors have responded to their identification of opportunities in their states to tap into for the well-being and socio-economic development of their states. It says, well done, guys. Please invite Professor Morris Iwu as well. That's from me.
Well, let me just read that one right there from Babajide Akiremi. He says, have you guys observed that Nigerians' lack of discipline, and compliance is only in Nigeria, where one of the most law-abiding, policy addicts and personally accountable people abroad, you can check crime and civil facts abroad, Nigerians' disdain for compliance at home, he says, the result of imported, impracticable ideas, mistrust of government, and poor accountability in the ranks of governmental bodies. Most senior public personnel are more interested in how to build castle-like homes like their politician bosses than holding their juniors accountable on their job description. Policymakers copy foreign solutions but fail to tailor them to our reality, and politicians flaunt their spoil of office in the face of citizens and get away with persecution. Politicians know what to do differently. They just lack the will to do it, but once they start benefiting from the status quo, well, it's quite a long one now. And Dr. Anthony Ude, thank you as well for your comments. So there you go. That is it today. Thank you all for watching. We'll see you again tomorrow. I'm Chamberlain Osal.
I'm Kayode Okikele.
I'm Ayo Makinde. Have a wonderful day.
And I'm Malpe Ogunyusuf. Thank you so much for your contributions.